The Center for Colon Cancer Research was started in October of 2002 with a very generous grant from the National Institutes of Health, and its original mission was to promote basic research on the biology of colon cancer with the ultimate goal of developing new strategies for diagnosis, prevention, and treatment.
What compelled me to join the CCCR Research Group was the ability to interact with researchers all over campus.
I was a young assistant professor just starting my academic career and looking for new research collaborations and looking for a way of advancing my research, and it was a great environment to be a part of.
It was obvious at that time that it was a good group of people to work with, and it was also an interactive group, so it was an opportunity for me to help build the biotechnology core that I direct through the basic science research that was available.
We're constantly thinking about innovation in the field, and we see that derived from the laboratory research that's being done. Then we focus in on the clinical research that's being done, and then taking that to the community. And it takes each of us to bring our expertise in the area of colorectal cancer to the table to make a difference.
I've been interested in DNA repair for a very long time, and it turns out that most cancer chemotherapy agents kill cancer cells by damaging DNA. Unfortunately, they also damage our normal cells. That's why you see the side effects associated with chemotherapy.
My own research is involved in understanding the molecular details of how cells become resistant to the kinds of drugs that are used to treat colon cancer. Problem that's of great clinical significance in cancer treatment.
And we know through a number of different studies that nutrition and dietary factors are related to both inflammation and colorectal cancer. So we are actively investigating dietary factors that are related to inflammation that may reduce inflammation, thereby reducing the risk of colorectal cancer.
My research focuses on understanding how people access and utilize care. And a lot of my research also focuses on the quality of care that people receive.
I'm in the School of Public Health, and specifically I'm in the Department of Exercise Science, which we're nationally recognized for what we do. But what we do is take our understanding of exercise and nutrition, and we overlay it on diseases and other specialties. Interacting with the people from pharmaceutical sciences and biology, and I've had a lot of good collaborations with people of chemistry, have allowed me to learn ways to analyze problems that I didn't have before. In interacting with different investigators with different expertise, which only allows us to compete at the national level or international level, where we can get the funds to carry out the high-level research.
The research that we carry out in our lab is largely focused around creating new diagnostics to detect and diagnose and stage colorectal cancer.
We're also developing a national reputation for being progressive. And I believe by having that national reputation that in South Carolina we're doing things differently and we're doing things creatively to tackle colorectal cancer prevention, that raises our profile. So in terms of research, I believe by having that better profile, by recognizing the good work that's being done in our state, we are more likely to achieve grant funding for our efforts and to have our efforts, the results of our research, recognized nationally.
To screen folks in South Carolina is going to be beneficial not only for the people who are able to be screened, but I think through some of this data that we're going to obtain, that we may find even better ways of screening larger populations.
I think in South Carolina, we've been very fortunate to be able to bring lots of different people to our task of reducing colon cancer in our state. We have providers through the gastroenterologist, we have Blue Cross Blue Shield Foundation, we have business people and academic as well as our public health providers around the state involved.
I have the privilege to be part of the Colon Cancer Prevention Network, which provides screening colonoscopies to the medically underserved across South Carolina. I get calls from patients thanking me for their colonoscopy, telling me how they're telling people in their communities, in their church, their sisters, their brothers. Through our navigation and education, the patients are so humbly grateful, and it's really emotional to see how patients can take such a bad experience and be so grateful for people willing to take time to give them the care that they can't otherwise get.
I joined the center in an effort to reduce the rate of colorectal cancer as my part in giving back. People that helped me out were so tremendous in helping me move forward, and I wanted to help as many people as I could on their journey through this.
Until it really affected my family, it wasn't something that was important to me. And I think now colon cancer is the work that I do. I work in colon cancer research. I try to get people out there getting screened, developing education programs to talk to people about the importance of colon cancer prevention. And so I think now it's translated not only into affecting my family, but that I'm hopefully affecting other people's families in a positive way.